today's session on articulated hand. This is articulated hand. And which side is this? This is right side. How can I say that? Because these are the bones of thumb. These bones present in the thumb. Thumb contains one metacarpal bone, two phalanges. But if you observe remaining fingers, one metacarpal bone, three phalanges. 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3. But if you observe thumb, one metacarpal bone, 1, 2, two phalanges. And if I keep like this, I can say that this is left. But here one more thing you have to keep in mind, that this is the dorsal aspect or dorsal surface of the bones. These dorsal surface of the bones are convex and these are ventral surface of the bones. These ventral surface of the bones are concave. So we have to keep concave surfaces in front and convex surfaces behind, so that this is right hand. That means right articulated hand. Clear? Then hand contains three sets of bones. Here these are the bones. These bones are carpal bones, and these bones are metacarpal bones, and these are phalangeal bones. So if you take these carpal bones, these are 8 in number, arranged in 2 rows, proximal row, distal row. Proximal row bones are scaphoid, lunate, tricotta and pisiform. If you come into the distal row bones, trapezium, trapezoid, capitate, hammet. To remember all these bones in order, we used to say one mnemonic: she looks too pretty, try to catch her. Scaphoid, lunate, tricotta, pisiform, trapezium, trapezoid, capitate, hammet. Then if you see common features of these carpal bones, all these bones are cubical in shape. What does it mean? If it is cubical in shape, each bone contains 6 surfaces: superior surface, inferior surface, anterior surface, posterior surface, medial surface, lateral surface. So each bone having 6 surfaces. That is one. Then these are ventral surfaces of the carpal bones and these are dorsal surfaces of carpal bones. Dorsal surfaces and ventral surfaces of carpal bones doesn't give any articulation. That means ventral surfaces and dorsal surfaces are non-articular except tricotta. This tricotta bone having articular surface in the ventral aspect. That means ventral surface of tricotta bone articulated with the pisiform bone. So that's what, this is the exception. Remaining all bones, ventral surfaces will not give any articulation. But this tricotta bone gives articulation with the pisiform bone in the ventral aspect. So that is one exception. Then if you see dorsal aspect of all these bones, this dorsal aspect of all these bones also will not give any articulation except pisiform bone. So dorsal aspect of carpal bones are non-articular except pisiform bone. See, this is pisiform bone. This pisiform bone having ventral surface. So this is ventral surface. This is dorsal surface. This dorsal surface of pisiform bone articulated with the tricotta bone. That's what this bone is exception. For what? Dorsal surface of this bone having articular surface. Then ventral surfaces of all these bones, they are narrow or smaller. If you observe dorsal surfaces, these are larger. That means dorsal surface of carpal bones are larger, ventral surface of carpal bones are smaller. Because of that only, ventral surface became concave, dorsal surface became convex. But here also there is exception. All ventral surfaces are smaller, all dorsal surfaces are larger except lunate. Lunate bone having ventral surface is larger and dorsal surface is smaller. That's what lunate dislocations are common when you are falling on the flexed position and the elbow in flexed position. And in that position, if you fall on the wrist, which leads to dislocation or ventral dislocation of lunate bone, which leads to compression of median nerve, which leads to carpal tunnel syndrome. One more common feature we have to discuss in the carpal bones. Proximal row will forms the superior convex articular surface, inferior concave articular surface. If you take distal row, superior convex articular surface but inferior flattened articular surfaces. These inferior flattened articular surfaces will be articulated with the bases of metacarpal bones. Lateral surface of scaphoid, lateral surface of trapezium are non-articular, and medial surface of triquetral, pisiform and hammet are non-articular. These are the common features. Recollect once again, carpal bones having 6 surfaces, all ventral surfaces are non-articular and all dorsal surfaces are non-articular. For these, exceptions are ventral surface of triquetral is articular, dorsal surface of pisiform bone is articular. All ventral surfaces are narrow, all dorsal surfaces are larger or broad, except lunate bone. For this lunate bone, ventral surface is larger, dorsal surface is narrower. After that, we have to discuss special features of all these bones. This is the scaphoid bone. The literal meaning of skiff or scaphoid is nothing but boat. It is boat-shaped bone. This bone is boat-shaped bone. So that's what they give in the name as scaphoid. This scaphoid having one prominent tubercle. This tubercle what we are calling tubercle of scaphoid. What is it? This is tubercle of scaphoid. Then scaphoid bone is largest bone in the proximal row and it will be articulated with the lunate bone capitate. And what is this? Trapezium. And what is this? Trapezoid. So it will be articulated like this in the distal part and in the proximal part it will be articulated with the radius. This is about the scaphoid. In this scaphoid we have to remember carefully that it is boat shaped bone. It is having tubercle. That tubercle what we are calling tubercle of scaphoid. That's it. Because when you are studying flexor retinaculum, this will only give attachment. So this is tubercle of scaphoid. Then next bone. What is this bone? Lunate. The literal meaning of lune means moon. This is half moon shaped bone. That's what this bone what we call lunate bone. Lunate bone ventral surface is larger than the dorsal surface. That's what lunate dislocations are common when you fall on the flexed wrist. If you coming to the lunate bone articulations, superiorly radius, laterally scaphoid, inferiorly capitate hammet, medially triquetral. These are the articulations. Then if you coming to the triquetral bone, the literal meaning of triquetral means 3-cornered bone. That means it is pyramidal in shape. It is having one special feature that the ventral surface of this bone having articular surface. Remaining all carpal bones doesn't have any articular surface in the ventral aspect. Then this bone articulated with inferiorly with hammet, laterally with lunate bone, ventrally with pisiform bone and superiorly with articular disc of wrist joint. That is about the triquetral bone. Then if you coming to the pisiform bone, the literal meaning of pisiform is nothing but P. So it is like small p. Actually it is sesamoid bone. What does it mean? Sesamoid bones are nothing but bones develops within the tendon. So this bone will develop within the flexor carpi ulnaris muscle. That's what this bone is, sesamoid bone. Coming to the second row, this is trapezium. This bone is trapezium. The literal meaning of trapezium is nothing but it is quadrangular in shape and it is having one groove here. This is groove and lateral to that groove there is a crest. So here this crest you have to remember carefully. Crest of trapezium. This is crest of trapezium. There will be one tendon will be passing through this groove. That tendon what we call flexor carpi radialis. Then it is having lateral lip and medial lip. Lateral lip will give attachment to the main attachment of flexor retinaculum. But medial lip will give attachment to the deep slip of flexor retinaculum. Okay. So in between these two slips there will be passage of tendon. So what we have to remember in this trapezium bone, we have to remember crest of trapezium. Now if you coming to the articulations of trapezium, superiorly it is articulated with what? Scaphoid bone. Laterally no articulation. Medially articulated with trapezoid and inferiorly it is articulated with first and second metacarpal bones. Trapezium having distal articular surface. This distal articular surface is concavo-convex. That means one part of the articular surface is concave and another part of the articular surface is convex. And it will be articulated with the base of first metacarpal bone and forms a first carpometacarpal joint. This first carpometacarpal joint is example for the saddle type of synovial joint. So that is about trapezium. Then if you coming to the trapezoid, it is looking like baby shoe and it is present in between the capitate and trapezium. It will be articulated with laterally trapezium, medially capitate, superiorly scaphoid and inferiorly second metacarpal bone. That is about the trapezoid. Then coming to the next bone, capitate. Why we are calling this as capitate? It is head shaped bone. That's what this bone what we call capitate bone. This is the largest bone in the carpal bones. If you go in detail, it will be having the head, neck and body. Okay, no need of that much details. This is the largest bone. It is present in between the trapezoid and hammet. It will be articulated superiorly with the scaphoid, lunate, and inferiorly with second, third and fourth metacarpal bones. Laterally trapezoid, medially hammet. Then coming to the next bone, hammet. The literal meaning of hammet or hamulus is nothing but hook. It is having the hook. This hook, what we call hook of hammet. So this is the special feature which is present in it. This is the hook of hammet. That is only, remember, that is sufficient. And articulations. Medially articulated with triquetral. Laterally with what? Capitate. Inferiorly with fourth and fifth metacarpal bones. That is about articulations. Now we will see some attachments. When you are studying about intrinsic muscles, anyway we will see. But mainly medially, pisiform bone and hook of hammet. These are the bones which give attachment to the most of the structures like flexor retinaculum and hypothenar muscles. And if you coming to lateral side, tubercle of scaphoid, crest of trapezium. These are the structures which give attachment to the flexor retinaculum and also thenar muscles. So from hook of hammet to the crest of trapezium, from pisiform bone to the tubercle of scaphoid. In this way, flexor retinaculum will be attached. Actually, the ventral aspect of these carpal bones are concave and there is a bridge formed by flexor retinaculum. So, there will be passage deep to the flexor retinaculum. So, that passage what we call carpal tunnel. Right? So, this is the carpal tunnel. Through that many structures will be passing that we have studied in the flexor retinaculum. So, this is about the carpal bones. Now, we will discuss about metacarpal bones. We have to give number from lateral to medial side. First metacarpal, second metacarpal, third metacarpal, fourth metacarpal and fifth metacarpal. These metacarpal bones having base proximally, head distally. Don't think that head will be above and base will be below. Base above, head below here. So, this is the base of the first metacarpal. This is the head of the first metacarpal. These are the bases of remaining metacarpals and these are heads of remaining metacarpals. If you observe, ventral surface or palmar surface of metacarpal bones are concave if you compare with dorsal aspect. See here, these are the dorsal surface of metacarpal bones. These dorsal surface of metacarpal bones are convex and they are having triangular impression. See, they are triangular impressions. Clear? So, dorsal surface of metacarpal bones are convex and the ventral surface of metacarpal bones are concave. And these bases are articulated with the carpal bones. That means distal row of carpal bones and forms the carpo-metacarpal joint. In between the proximal row of carpal bones and the distal row of carpal bones, here one more joint is there. This joint is mid-carpal joint. So, the joint between the two rows of carpal bones, this is mid-carpal joint. And the joint between the carpal bones and metacarpal bones, this joint what we are calling carpo-metacarpal joint. So, these joints are carpo-metacarpal joints. Then these are heads. These heads articulated with the proximal phalanx. See, this is head of the second metacarpal and this is the proximal phalanx of index finger. It forms the metacarpophalangeal joints. So, these joints what we are calling metacarpophalangeal joints. So, these metacarpophalangeal joints forms the knuckle. So, these are what we are calling knuckles. Right? These are knuckles. Clear? Head of metacarpal bones with the base of proximal phalanx forms the metacarpophalangeal joints. And what is the difference between these four metacarpal bones and the first metacarpal bone? The first metacarpal bone is shortest and stoutest. Here, thumb having only proximal phalanx and distal phalanx. That means only two phalanges are there. But if you observe remaining fingers, proximal phalanx, middle phalanx and distal phalanx. Proximal phalanges are very long and middle phalanx are intermediate and the distal phalanx are very small or very short. If you observe distal phalanx, you can see expanded portions. These expanded portions are present in the finger pulp. In between the phalanges, there will be interphalangeal joints. This is proximal interphalangeal joint and this is distal interphalangeal joint. But if you observe in case of thumb, only one interphalangeal joint is there. So, this is one interphalangeal joint. But in case of remaining fingers, this is proximal interphalangeal joint between the proximal and middle phalanges and the distal interphalangeal joint in between the middle and terminal phalanx. So, this is proximal, this is distal interphalangeal joints. This is about the articulated hand. And if you wanted to see the muscular attachments, in case of ulnar side, this pisiform bone and hook of Hammet and the flexor retinaculum will give attachment to the hypothenar muscles. What are those? Flexor digiti minimi, abductor digiti minimi, opponens digiti minimi. So these are the muscles which are attaching to the pisiform bone, flexor retinaculum and hook of Hammet. Then if you observe lateral side, this is scaphoid bone. Scaphoid bone and trapezium will give attachment to the flexor retinaculum and the thenar muscles. What are thenar muscles? Flexor pollicis brevis, abductor pollicis brevis and opponens pollicis. Then if you see the attachments of metacarpal bones, near the base at the medial aspect of the first metacarpal bone will give attachment to the first palmar intraossei. Here first palmar intraossei, where it will insert medial side of base of proximal phalanx of thumb. So from here to here, this is first palmar intraossei. Then second palmar intraossei taking origin from the medial aspect of second metacarpal bone and inserting to the medial aspect of base of proximal phalanx of index finger from here to here. So this is second palmar intraossei. If you take the third palmar intraossei, it is taking origin from the lateral aspect of fourth metacarpal bone and inserting to the lateral aspect of base of proximal phalanx of ring finger from here to here. Fourth palmar intraossei. It is taking origin from the radial aspect of fifth metacarpal bone and insertion radial aspect of or lateral aspect of base of proximal phalanx of little finger from here to here. Right? And one more important attachment here we have to remember. Ventral surface or palmar surface of third metacarpal bone giving origin to the transverse side of adductor pollicis. Bases of second and third metacarpal bones will give origin to the oblique head. Both heads will be united and inserted to the medial aspect of base of proximal phalanx of thumb. That means at this place. Base of proximal phalanx of thumb at the lateral aspect will give insertion to the abductor pollicis brevis and flexor pollicis brevis. Then opponens pollicis will be inserted on the ventral aspect of the first metacarpal bone. And if you observe here, flexor digiti minimi and abductor digiti minimi will be inserting to the medial aspect of base of proximal phalanx of little finger. But the opponens digiti minimi will be inserted here. That means ventral aspect or palmar aspect of fifth metacarpal bone. Then if you see the insertion of flexor digitorum profundus, tendons of flexor digitorum profundus, after passing in between the two slips of flexor digitorum superficialis, they will be inserting to the base of terminal phalanx. If you take the thumb, flexor pollicis longus will be inserting here, base of terminal phalanx. If you take tendons of flexor digitorum superficialis, divide into two slips and they will be inserting to the either side of the middle phalanx. It will be divided into two slips and they will be inserting to either side of the middle phalanx. These are the muscular attachments in the ventral aspect. Then if you see muscular attachments on the dorsal aspect, all dorsal intraossei are bipinnate muscles. So these muscles will be taking origin from the adjacent sides of metacarpal bones. If you take first dorsal intraossei, it is taking origin from the adjacent side of first and second. Second one is from the second and third. Third one is from the third and fourth. Fourth one is from the fourth and fifth. That means from this area. Adjacent sides means one head from here, another head from here. After taking origin from the adjacent sides of first and second metacarpal bones, first dorsal intraossei becomes tendon and it will be inserting to the radial side of base of proximal phalanx of index finger. That means from here to here. Along with that, it will be inserting to the dorsal distal expansion. And this one also like that only. Second dorsal intraossei taking origin from the adjacent sides of second and third metacarpal bones and it will be inserting to the radial side of base of proximal phalanx of middle finger. Then if you observe third dorsal intraossei, it is taking origin from the adjacent sides of third and fourth metacarpal bones. It will be inserting to the ulnar side of base of proximal phalanx of middle finger. And if you take fourth dorsal intraossei, it is taking origin from the adjacent sides of fourth and fifth metacarpal bones and it will be inserting to the ulnar side of base of proximal phalanx of ring finger. That means palmar intraossei are going away from the middle finger and dorsal intraossei are converging or coming towards the middle finger. That's what palmar intraossei are adductors. All dorsal intraossei are abductors. You can remember pad and dab. P-A-D. Pad. That means palmar intraossei. A-D. All palmar intraossei are adductors. Dab. D-A-B. Dorsal intraossei or abductors. If you take the extensor compartment muscles, extensor pollicis brevis will be inserting to the dorsal surface of proximal phalanx of thumb, and extensor pollicis longus will be inserting to the dorsal surface of distal phalanx of thumb. Then if you take the extensor digitorum tendons, those extensor digitorum tendons will form a dorsal digital expansion. Those dorsal digital expansions will be inserting to the middle phalanx and terminal phalanx. Then dorsal surface of base of second metacarpal bone will give insertion to the extensor carpi radialis longus. Dorsal surface of base of third metacarpal bone and dorsal surface of base of second metacarpal bone will give insertion to the extensor carpi radialis brevis. So these are the few attachments. Then if you take the applied aspects, scaphoid bone is most frequently fractured bone. If there is fracture of scaphoid bone, sometimes leads to avascular necrosis, because usually two nutrient arteries will be entering into the scaphoid, medial half and lateral half having separate nutrient arteries. So medial half of the scaphoid bone supplied by one nutrient artery and lateral half of scaphoid bone will be supplied by another nutrient artery. If there is fracture in the center, there is no avascular necrosis, because each half will have separate artery to supply. Sometimes both arteries will be entering from one side only and they will be supplying. At that time, if there is fracture, the distal part of this bone will not get blood supply, it undergoes avascular necrosis. If there is fracture here, patient will feel pain in the anatomical snuff box. This is anatomical snuff box. Here, patient will feel pain and there will be pain along the thumb also. Then another applied aspect, dislocation of lunate bone. Whenever we fall on the wrist like this with elbow flexed, which leads to dislocation of lunate bone. Here flexor retinaculum is there. Here median nerve is going. Observe here. Here flexor retinaculum will be present. Median nerve is passing like this. This is the lunate bone. If lunate bone is dislocated, it comes front and it will compress the median nerve, which leads to carpal tunnel syndrome. Then another one is Bennett fracture. Bennett fracture is nothing but fracture of base of first metacarpal bone. Here at this level, if there is fracture, that fracture what we are calling Bennett fractures. The next applied aspect is fracture of fifth metacarpal bone. See here, this is fifth metacarpal bone. Fracture of fifth metacarpal bone, what we are calling boxer's fracture. Usually skilled boxers will not make fist very closely, but unskilled boxers, if they make their fist very closely and if they hit, which leads to fracture of fifth metacarpal bone, that fracture what we are calling boxer's fracture. These are the few applied aspects related to the articulated hand. I think this is sufficient. That's it for this session.